The Neurovascular Center of Excellence at UPMC Children's Hospital of Pittsburgh is a multidisciplinary clinic where patients from all over the country come to have their needs met through open endovascular or radiosurgery. We spoke with their surgeons to learn more in today's Bridging the Great Health Divide, sponsored by UPMC Children's Hospital of Pittsburgh. Arteriovenous malformations are tangles of blood vessels most often found on the spinal cord and in the brain. They can disrupt blood flow and oxygen circulation. Moya-moya disease is a narrowing of blood vessels in the brain, which could lead to seizures and strokes. These are two of the most common abnormalities treated at the Neurovascular Center of Excellence at UPMC Children's Hospital of Pittsburgh. Dr. Alhamza Al-Bayadi is an endovascular neurosurgeon. He explains his work.
What makes us unique, one-stop shop, if you will, is we have the different technique and modality in tackling all the cerebrovascular diseases. We can do basically an endovascular surgery where we go in the arm or the leg inside the blood vessel, go with a small tube called a catheter, all the way to that malformation or lesion, and try to embolize, which is another word for shutting down the arterial contribution to this area as much as safely possible to make the rest of the surgery, the open surgery, safer.
Al-Bayadi says communication between surgical teams is an asset to patients.
What makes us unique, instead of traveling, seeing Dr. X and Dr. Y in two different states, and then they communicate and try to do a collaborative work. Here, we bounce out ideas by each other when we see the patients in the clinic and plan accordingly for their surgical treatment if warranted.
Dr. Stephanie Green is the Director of Vascular Neurosurgery at UPMC Children's Hospital of Pittsburgh. She says the hospital is on the leading edge of treatment.
We have some technology that's not available everywhere. We have an intraoperative MRI, which makes some of our surgeries safer. We also have an intraoperative CT, so we don't have to move patients all over the hospital. On a radiology front, we can do functional MRIs, which localize different functions to different parts in the brain. So we can see, say, where speech is relative to somebody's arteriovenous malformation and plan surgery more safely because of that. We also use a technique called fiber tracking that shows us how the nerve fibers are deviated around a malformation. So that's another thing that we do that helps make surgical planning safer.
Both Al-Bayadi and Green are proud of the advanced work that they and their colleagues perform in Pittsburgh, which they say is among the best available in the country.
Our research mission in University of Pittsburgh and UPMC in general, and even more focused on the cerebrovascular diseases, is really one of the top notch in the country, if not even in the world.
I think it's almost priceless to work with colleagues that you trust, that you know are the best in the business, and that are committed to patient safety and advancing care the way that you are.
To learn more about the Neurovascular Center of Excellence at UPMC Children's Hospital of Pittsburgh, call 412-692-5137 or visit Great Health Divide at chp.edu.